We're pre-K through 12 Catholic school with about, I think we're close to 300 students in the system. And then I'm the president of the school, so I oversee all the administration, but then I also teach junior religion. So I'm in the classroom every day. For me, you know, when I think back at the pandemic, the most memorable was that moment of realizing things were going to be drastically different with the shutdown of the schools, and then our shutdown of our churches happened right after that. And so it was a new way of learning how do we live and still function, but yet be safe. You know, I think it's one thing to watch and have watched the pandemic develop on the news. You know, you see kind of the global perspective, and it really doesn't start to hit home until you start to experience it. And for me, that was pretty early on in the whole pandemic process of spring of 2020, I guess, when my parishioners started to die from it. And it was almost immediately after, you know, the major shutdowns and things, then the calls of, you know, hospital visits coming in for parishioners who were severely sick. That hit some of those frontline workers who happened to be primarily of our immigrant community. So our Micronesian community was impacted in a really dramatic way. A number of the COVID burials that I did were from that community, as well as our Hispanic community. I think the vaccine started to roll out January when the first kind of line started to get it, and I was excited because as a teacher and, you know, a frontline worker in the school, I was ready to roll up my sleeves. So the minute that it became available, we organized with the public health and had them come in and give it to our teachers and our administration and staff. And so for us, that was kind of the first sigh of relief in the midst of the pandemic to say, this is actually could be something that can help us move forward to lead a more normal existence again. Yeah, I've been pretty honest from the beginning about both with our school parents, being honest about, because again, in that situation, you have parents who were very concerned about the safety measures and all of those sort of things, and then other parents who didn't want their kids in masks and didn't want their kids behind screens and, you know, all those sorts of things. And so for us, it was expressing the unpredictability of how the virus affects individuals and saying we're going to enact these measures as safety measures, and we're just going to observe that because we want the best, obviously, for our students in the school. Kids are resilient, you know, I think way more resilient than adults. So I, you know, in the midst of last year, really received very little pushback from kids. I think in some sense, as vaccinations got in place and mask mandates got forbidden and those sort of things, people really did kind of let their guard down. And my experience now is COVID is kind of a distant memory amongst many people. While just today, I visited the hospital of a patient who has COVID and, you know, it's not looking so good. And so I think people are missing that reality is still present in our communities in small town Iowa, and it is taking people's lives. It continues to. I've encouraged from the beginning to be vaccinated. Our Holy Father has encouraged vaccinations, as has our bishop, as the Bishops' Conference has, and so, you know, I also teach moral theology in our school, and so, you know, there really is nothing holding us back from receiving those vaccinations from a moral standpoint, from a spiritual standpoint, and really as we look at Catholic social teaching and solidarity, it really is a good thing for us to do for the health and welfare of our community and for our brothers and sisters. Es un acto de solidaridad para recibir la vacuna para ayudar su propia salud, pero también la salud de la comunidad.